Brilliant. Good afternoon, Dr. Thouvenot. My name is Rahul. And first of all, welcome to 72 Dragons. It's a pleasure to have you here. My name is Rahul. I'm one of the writers for 72 Dragons, and we are a production company based in Hong Kong. Our purpose of producing these videos is to spread awareness and create a 72 Dragons community where we talk to health experts and gain and share knowledge, and through this creative platform. And we also have Dr. Pietro Aparicio. He is the Chief Operating Officer of 72 Dragons. Dr. Pietro.
Great. Welcome, Dr. Vernoique Inez Thouvenot. Is an e-health and telemedicine international expert, advisor, and scientist at UN agencies, and also the co-founder at Zero Mothers Die. Thank you, Veronique, for sharing your knowledge and expertise with our audience today. Let's talk about the Zero Mothers Die initiative. It has been 10 years since its conception on May 22nd, 2012, at the Geneva Global Health Dynamics Roundtable. How did this idea first come to your mind, and how did it evolve into what it is today?
Thank you very much for kind invitation, Dr. Aparicio and Rahul. I'm very honored to be part of your work in benefiting of that interview for Zero Mothers Die. So yes, Zero Mothers Die started in 2012 in Geneva because the three co-founders, we were sitting at the same round table at the Global Health Initiative conference during the UN General Assembly in Geneva. And that's where we met. We were the three of us coming from different horizons, but all working in UN agencies. And maternal health, UN agencies are very committed to reducing mortality of women around the world. So we discussed that our three organizations, Advanced Development for Africa Foundation, co-founded by Dr. Kumba Toure, she was working at the World Health Organization at that time. Universal Doctor, the co-founder is Dr. Jordi Serrano-Pons, and he is leading digital innovation all around the world. And the Millennia 2025 Foundation, we want to create an ecosystem with digital innovation to contribute to the reduction of maternal mortality by 2015. In that time, Millennium Objective Goals at the United Nations. So this was the idea. Of course, it was not all built. We wanted to contribute to that reduction and to use digital innovation in those times. The three of us, we were working in different countries and traveling quite a lot. And we were okay, the three of us, with other partners and organizations. That mobile expansion was growing very fast. Today, it's just normal. 10 years ago, it was not that so normal, but we were seeing that growing very fast. And the mobiles being used for business, for agriculture, for any purposes. The context, global context, is that in the world, 800 women die per day because of the causes of pregnancy. So these are huge numbers, and they die not because the science doesn't know the drugs or the vaccination. They have to invent something. No, for maternal health, everything is known, everything is there. What women lack is information and education, and one of the ways to disseminate that is to use digital innovation.
Great.
So 10 years after, Zero Mothers Die is an entire ecosystem of tools and services that uses digital innovation to reach those women in the most remote places.
It all started in Geneva, and then on December 3rd, 2012, Zero Mothers Die was presented at UNESCO Paris. Then you join hands with the United Nations General Assembly, then the BBC, and then many more. So my question to you was, so what challenges did you face while talking to these international committees and government bodies?
First, before having challenges, it's a fantastic opportunity to connect with people that really know what's happening and how to join forces. But challenges are so numerous. Biggest challenge, I would say, it's human resources, because it takes a long time to establish the work plan, in all the different phases. And in the meanwhile, the people leave their positions. They go to work in the private industry, in another country, in another agency, and then we have to redo the whole work again. And it took us about 4 years of work in Ghana, and at least 3-4 years in Mali. All the documentation is there, but the people have left. And so we don't know where to knock the door anymore. And finally, it didn't happen in those two countries because of that continuous movement of human resources. And it's the same with Ministry of Health. In many countries, Ministry of Health don't stay more than 1.5 years or 2 years. So it's too short, to have a full workman accepted and the financial side done too.
Great. So maternal mortality is, the numbers are just too high for something that could be preventable. And we know that the numbers are higher in the developing world. And Zero Mothers Died has a mobile application, which is global and accessible to everyone. It is available in 9 different languages so far. How did you make a mobile application that is user-friendly and custom-made for every community in Africa, Asia, Europe, and the Americas too?
So Zero Mothers Die is unique in the market of mobile applications for maternal health because it works on the localization of the app. We do not use translation. We do not use Google Translate for all the content of the app. We work with local organizations, communities, nurses, midwives, doctors to localize the content of the app, word by word, sentence by sentence. So it's not a translation word by word, we translate and stop. No, it's written as it is said in that community. Oh. So it's a much longer process. Of course, it takes much more time, but we work very well with the local NGOs or hospitals or research institutes, with their students, with their interns, to localize the app.
Well, I must admit that that's a very interesting take on this, because working on an application, and certainly we all know that Google Translate cannot be 100% accurate, and because of which we are working with a local community, which actually brings a natural communication in the mobile application, which basically helps the community. So my next question to you was actually related to this, because you've worked in different communities like Africa, Asia, Europe. So can you give us some specific case scenarios in countries where Zero Mothers Die is actively working, and what were the challenges while working with these small communities?
Okay, so we have, for example, we can give today, I will try to be short. In Nigeria, in Abuja, we work since 8 years with Trafina Foundation, which is led by Kimnozo Ikpe. She is a midwife and a nurse. And now the app is in Nigerian Pidgin. And she does all the dissemination and the information and education in local clinics in northern Nigeria. And this is a tremendous work to do. What is important is that the app is there to save the lives of the women. So everything that is in the app, it is very important that it is accurate. And really brings the women to take the adequate decision on what is happening at that time for them. We have another implementation in Brazil, in Rio, with the Fiocruz Institute, where Angelica Silva is a scientific researcher, and we have published one scientific article, at least, on zero mothers die in Brazil. We're working with communities in the slums in Rio and also in Manaus, in the Amazonas zone. Unfortunately, due to the government, the actual government, there has been cutting funds, public funds for maternal health. So we have to redo the entire budget. But we hope to have the opportunity to pursue the program next year. Another option is we work with the Hospital of Gambo, which is situated in South Ethiopia, about 1,300 kilometers from Addis Ababa, with Dr. Iñaki Cole Alegria. And in that hospital, the app is used by all the women getting pregnant and coming for the visits, antenatal visits. So they have it on their mobile in Oromé and in Amharic. You can go to the website and see how it looks, Oromé and Amharic. It's very hard to read. But the app has been developed there locally by the doctors and the nurses working in that hospital. And more than 18,000 women have been using it in preventing their deaths, hopefully. But they are all very happy with the app up to today. And the last one is in DR Congo, in the clinic of Lumaka, where we use Zero Mothers Die in mostly in French. It is adapted in French and in the local Swahili.
Fantastic. So definitely Zero Mothers Die has grown tremendously and has reached a global audience. So what are the future goals for Zero Mothers Die?
So just to come back to the Zero Mothers Die web in French, it has had 500,000 views last year only. So it's creating a lot of interest. UHDA, which is a spin-off of Universal Doctor, and that provide dedicated and tailored for maternal health and child health data collection, analysis, and evaluation. We would like to advance with another project we have, which is the geolocalization of the midwives and the women, pregnant women at high risk. So this is already done in Southeast Asia with GeoHealth, which is located in Manila in the Philippines. The project is already written, but we look for partnerships to have funds to do that and to do the pilot versions in the coming months.
Fantastic. That's amazing what Mothers Die is doing in the coming projects.
Yes, it was really amazing to hear all the initiatives that you've taken and how far you've come with this particular initiative. And you've worked with so many communities. So we are trying to bring this community together and achieve the target or accomplish the Zero Mothers Die initiative. Well, this brings us to the end of our interview. It was amazing having you here, and it has been a great pleasure talking to you.
Veronique, again, thank you so much for sharing with us the fantastic and innovative work of Zero Mothers Die. And for those who are listening, stay tuned as we continue the conversation about Zero Mothers Die with members of the team around the world. Thank you.